Welcome to another edition of My Health, My Life. This show was created to provide information to the women about their health issues, be it physical, mental, social, emotional. We want you to know more about your health and all the things that pertain to you. Today, we're going to talk about a topic that is really significant and really serious and a major public health concern, and that is sexual assault. Sexual assault, or sometimes interchanged with saying rape, is a major public health concern with negative consequences on women's health and children's health. Rape is defined as any penetration, no matter how slight it is, of the vagina or anus, or even oral penetration without the consent. For the purpose of this show, I'll be focusing on sexual assault on women. As we know, children are more vulnerable to this situation than even adults. But we're going to focus on women today. So what is the incidence of rape in Nigeria? You see, when you do that research, the statistics vary really from one side to another. And I believe that's because reporting of rape incidents is still so low because of obviously cultural or religious beliefs, or just also for the fact that when it's reported, nothing is really done about it. Sexual assault can have negative consequences on health, from having acute injuries like trauma to the vaginal vulvar region. In more severe cases, you have fractures, lacerations on any parts of the body, welts from things that are used, scratches, down to more severe vaginal and vulvar lacerations, injuries that may even require surgical interventions. We have even major trauma to the women, physical trauma, when weapons like knives or guns are used, and sometimes it could even lead to death. When a woman is being assaulted, they lose control, self-control of themselves or the situation, have absolutely no control during that situation. And that actually leads to significant mental health consequences. You have the short phase. So the immediate phase of you see a rape victim, what you see mostly during that phase is first a depressed mood, obviously, depressed mood. You see that they get a lot of mood swings, from anger to, they get a lot of anxiety. They get a lot of, they're easily frightened. And they start having increasing phobias, nightmares, sleeping disturbances. And this all stems from that sexual assault. You have the long-term effects, like things like post-traumatic stress disorder, where the quality of their life decreases. They get flashbacks. So they get they have sexual dysfunction. And why I'm bringing this up is because many people hear about sexual assault and sometimes they even brush it away and not understand why the fight against violence against women and children is so important. It's because it is a health hazard. It can ruin someone's life. And I'm not only talking about physically, I'm talking about mentally, I'm talking about emotionally, and I'm talking about socially. So it goes across the whole spectrum, and it can make your life change like that, from being normal to having a lot of significant issues. Why I make this message is that we as providers, anybody in women's health, as women health providers, or even the general practitioner out there, should always screen their patients for sexual assault. Not many women will come to your office and say, I was raped or I had sexual assault. And in our climb in Nigeria, women don't report it, because I've heard a case where a young lady was assaulted and I asked, why didn't you come? Why don't you want to talk about it? I can get help for you. And she said, no, because my parents don't want this to go out there because of the embarrassment it may cause them. It is not your embarrassment. You should never feel guilty for being raped. You did nothing to deserve rape. And that's just the truth. There's nothing. And that's a significant thing we talk about. Remove the self-blame. So please do not ever cause any victim of rape to believe they're the cause of it or to be ashamed of coming out to report it. Because only by doing that can we be able to fight for the enforcement and implementation of rape laws in our community. Another complication of sexual assault is pregnancy. So we get a lot of pregnancies, unplanned pregnancies, from rape. So when a patient comes to us as a gynecologist or a women's health provider, we carefully screen the patient for all the spectrum, for all the sexually transmitted infections that we can screen for. We also do that and place the women on medications to treat those infections, just in the case that those test results are positive, and if they're negative, then we can stop them. But we do treat them right away, and we also put them on prophylactic, on what we call Plan B in terms of pregnancy to prevent unplanned pregnancy. Counseling is a fundamental part of managing a rape victim. So we do insist that they go through counseling. Counseling is very important, that they're counseled and they're followed through for as long as it takes for them to be able to regain control of their life. And this message is to talk and hopefully create awareness of why it's so important in many ways to prevent rape in our community and to make sure that laws implemented that will reduce or even eradicate rape in our community. The sad part is that most women that are at risk for severe injuries from rape is done by people that are close to them, they're intimate with, so people that they're actually maybe intimate with presently or maybe immediate past partners, and people that are acquainted with. And that's the sad part of it. It's always most times the most dangerous and the ones that bring out more injuries on our victims. And if you have any questions or you have been in this situation and you want help, do send a message to the information that is scrolling below. We will connect you to the right place to go and the right person to speak with. We'll make sure that we keep it confidential, and because it's so important if you're out there, this message is for you. Thank you for listening to My Health, My Life. I'm sometimes sober when I talk about issues like this, but I am happy that I'm able to get this information through this medium out to you. Have a great week, and I hope to hear from you.